Well, on behalf of my team, myself, I'd like to thank you, our female tribe. You're here to create a better life for yourself. And also, we want to invite our courageous man who's going to be here to learn about menopause in order to support all women in his life. So, as a matter of fact, this is actually for men as well as for women, because if men don't know what's going on when women go through menopause and all the gazillion symptoms that would come with it, they don't have an understanding. They won't be able to sympathize. They won't be able to support them or help them. Do you agree? So next time we do this again, and there's plenty to talk about menopause. Let's encourage for the men to come along also, and then we'll have fun things for them to do also, right? Well, again, thank you for being here, for creating a better life for yourself. So we're going to talk about menopause, and I know that you're here for yourself, and or possibly for someone that you know and love who are going through menopause and have some of the symptoms. I also would like to thank our special guest, Miss Liz.
Hello.
And
Hi.
Miss Liz it has taken time out of her very busy day to be here with us and share her gracious knowledge. She has a wealth of knowledge, and she's done our lunch and learn in the past, and here she is today, and I can't wait for her to take the stage. So I'll try to go through this as fast as I can, so that way she can share with you amazing knowledge that she's brought with her. So let's first talk about a little bit about anatomy and physiology. Okay, so you gotta excuse my poor drawing, but that was my attempt to draw a brain for you guys. I used to teach anatomy and physiology at school and dissect and literally on the cadavers teach every parts of the anatomy and physiology. But drawing it is it's a different animal. So there is our brain, and in the brain, small, like literally, there is hypothalamus, which is about this small, in the brain, deep inside the brain. And then from hypothalamus, we have the pituitary gland. So hypothalamus is the control center that produces the gonadotropin hormones. And hypothalamus produces or stimulates hormones for the pituitary gland in order to produce FSH and LH, the follicle stimulating hormone and luteinizing hormone. And these hormones go down to the ovaries, and our ovaries produce estrogen and progesterone. So estrogen, at the same time, we have our ovaries. This is our ovary. This is the fallopian tube, okay, that goes to the vagina, okay, the uterus and the vagina. So these are our follicles. And when FSH and LH, that are hormones, sex hormones, they produce, they go to the ovaries and they help with the growth and development of the follicles. Now, these follicles have eggs in them. So these eggs, basically, when the follicles reach maturity, the follicle ruptures and releases the egg. And the egg that comes, oh yeah, sorry about that. Oh yeah, this is better. So the egg that matures, it actually releases, the follicle that matures releases the egg, and the egg releases, goes into the fallopian tube, and waiting for sperm to come and for the fertilization to happen. Sometimes it happens, sometimes it doesn't, right? So when estrogen has a rise, increase in estrogen level, it gives a message to hypothalamus to release LH. When there's an LH or luteinizing hormone surge, it causes the follicle to rupture. And then that's where the egg releases. And then progesterone is produced. When progesterone produced, the function of the progesterone is to thicken the wall of the endometrium. So the wall of the uterus, endometrium, thickens. That means it's getting ready for possibly a pregnancy to happen, right? But if our egg goes in the fallopian tube and in the uterus, and the sperm is not there, or the pregnancy doesn't happen, fertilization doesn't happen, what happens to the wall of the endometrium that gets thicker, but there's no pregnancy? What happens to it? It sheds. So it starts to shed. And then there's lots of vessels, blood vessels, that actually the hormones help to grow angiogenesis, to produce tiny little vessels, so more blood vessels in that area. So the linings get ruptured, blood vessels get ruptured, and then the woman goes through the cycle, bleeding. Yes? Okay. So basically, that I just wanted to make this very simple anatomy as to the control center. It starts with the hypothalamus, then the pituitary, and then it releases all the hormones and goes all the way down to the ovaries, and that's the ovaries and the eggs, and what happens when the eggs is released, and so on and so forth. Any questions about this so far? No questions. Okay. Just pay close attention, because at the end we have several quizzes, and then you get them right, you get awarded. Okay. So that was our endocrine system. Well, we're here to talk about menopause, but we know that there's very little research that gets done on menopause. So when you go to MedPop has 1.1 million, plus or minus, articles on pregnancies. Guess how many articles there are on menopause? Liz is shaking her head.
Come on.
94,000 articles on menopause. That's literally less than 10% of the funding for menopause. So what does that mean? Doctors that go through college and schooling to become doctors, they know very little about female hormones and what happens when they reach menopause. So unfortunately, when women reach the menopause stage, going to Western medicine doctors, they literally are science, or rather our doctor, Western medicine, fails them because they really don't know what to do. So when they go to their doctors with all these different symptoms, they walk out with 7, 8 different referrals, one for cardiologist, one for OBGYN for looking at all the symptoms down there, or psychiatrist or psychologist because of all the mental health issues that they are experiencing. And so, and endo, exactly. So orthopedic surgeon. And so because of the bone pain or joint pain and muscle pain. So having said that, well, we know that we lived the third of our lives from after menopause. We lived the third of our lives in poor health. So even though it doesn't get any attention, hardly any, but that's also important, because imagine living the third of our lives from the age of 51, when we're menopause, and then post-menopause. For the rest of our lives, we're in post-menopause. And we'll go over, all the symptoms and all the health challenges that we have to go through in post-menopause until however long that we live. Dealing with all those symptoms, it's not easy, to say the least, and it's challenging. So it's just as important for more doctors to do more research and be able to have more understanding as to why we lose our estrogen and progesterone and our testosterone, half of it. And we have to go through the rest of our life with these absolutely necessary hormones. So by the time we're at age 51, by the way, this is interesting to know. When we're born, we have 1 million plus and minus eggs. when we're born. And by the age of 30, we lose 90% of those eggs. 90% of those eggs. Chicky's eyes got wide. And by the age of 40, we're down to 3% only. And of course, by the age of 50, we have 0 eggs. So no more cycles, and that's where the perimenopausal and menopause starts. And menopause, from the day that you have your last menstrual cycle, that's the last day, until 1 year that you don't have your menstrual cycle, that's your post-menopause. And then after that, we're in post-menopause for the rest of our lives, having to deal with no estrogen and none of the sexual hormones except for a little bit of testosterone. And then here comes the chaos of all these different symptoms. Questions, Ms. Roya?
Yes. So if you're, two questions. One, so by the age of 30, if you've lost 90% of your eggs, so does that mean that up to the age of 30, every woman, when they have their period, they're losing more than 1 egg?
Every time.
Every time they're losing,
so every time
like
they,
many eggs.
Yes. So from the time that we're born with 1 million eggs, we are constantly, every time that we have the cycle, we lose eggs. And our ovaries actually shrink and they lose the function as well, because there's our ovaries that have to release the eggs, right? Through the follicles, right? So by the age of, you said 30, we're down to about 10% of our eggs. By the age of 40, we're down to 3%.
Yeah.
Lucky women who want to get pregnant, they may get pregnant, but there's always chance of complications with chromosomes, abnormalities with the baby, and so on and so forth, right? And obviously, they have a difficult getting pregnant to begin with.
So I thought that you just lose 1 egg at a time. So you're losing multiple eggs.
Right.
The second question is, what if you are 50 plus and you're still getting your periods? You said that after 50.
So that's give and take. So at about the age of 50, 51, maybe 52, that's when your menopause, the last period you get, menopause ends. That's the marker of post-menopause. If you don't have it for 1 year clean, and if your body is relatively doing what it's supposed to do and with no complications, and it's not a surgical abruption of your cycle, and if it's no pathology, that your body naturally, the transition is that you stop your menstrual cycle, and the day that you stop your last menstrual cycle and you don't have it for 12 months, 1 year, you're in post-menopause, and then beyond for the rest of your 30, 40, and hopefully beyond years, you're in post-menopause. So here we are, the rest of our lives, we're in post-menopause, and post-menopause with no estrogen, 0, no progesterone, and just a little bit of testosterone. Okay, well, let's see.
Sorry, and that's why woman will have a window to get pregnant.
To get pregnant. At the prime of our time, when the ovaries are functioning at their best and there are enough eggs that are to be released. Yes, absolutely. That's the prime time to get pregnant. Right. So without estrogen and progesterone, pretty much all of our bodies, every system in our bodies get disrupted. Unfortunately, our doctors are not being educated. I'm talking about going through the schooling of medical schools, and it's not even in the curriculum. So they're not even being educated about hormones, maybe just a very, very basic, but they certainly have, it's not even in their curriculum as to what to do for women when they're menopausal. I know that my mom many years ago I took her to several OBGYN doctors, and she was in her menopausal, but then they said to her, well, why don't we do all these hormone replacement therapies, and she started having heavy bleeding, and then they immediately took it off, and it was all synthetic, and took her off the medications because at the time all the research, which is, I'm not going to get into it, but the research showed that those women are getting cervical cancers and breast cancers. But the research, looking back into it as to who the research was done on, what patients, what symptoms, and what age with cardiovascular disease, that research was not actually accurate. Okay, so now with functional physicians, you see them that they're being certified. Now they're educating themselves to help more women with menopause. They know that they can help them by estrogen or estrogen, progesterone, estradiol patches or cream, and help them with the symptoms. But most importantly, let's go down through the symptoms, the list of our symptoms. So, okay, so hot flashes and belly fat are the ones that everybody can relate to for menopause symptoms and complaints, right? Are you experiencing menopause, honey? And the hot flashes. Okay, well, but did you know that heart conditions, I'm just going to, for sake of reading this faster, I'm just going to go down the list. Heart conditions, frozen shoulder as a result of menopause symptoms. Chicky, I've got your attention. Muscle loss, bones or bone loss, or osteoporosis. Okay, osteoporosis is a no-brainer because everybody knows that one. Night sweats, hot flashes, right? Horrible rage. It's not our fault. We want to rip their heads off. It's not our fault. Joint stiffness and muscle pain, loss of sex drive, painful sex, UI, urinary incontinence, UTI, especially chronic UTIs that definitely is, in some cases, it can actually be quite serious, and some women die from it. Tinnitus or tinnitus due to low estrogen levels. Menopause symptoms.
Hearing?
Yeah, ringing in the ears. Did you know that? That could be one of the. So all these symptoms that I'm going to be reading to you guys, it doesn't mean all women get all these symptoms. Some women get some of the symptoms, and then others get some other symptoms, right? So, dry vagina, dry mouth, dry eyes, dry skin and wrinkles, and pelvic floor muscles weakening and prolapse. Okay, and we know that estrogen receptors are in the brain. So brain has receptors for estrogen. So estrogen goes down, guess what happens to the brain? Mental issues, mental wellness starts to decline. And what does that mean? Many women complain about mental fogginess, affects their focus and concentration, anxiety, depression, irritability, right? What else did I miss? Yeah, and many more. So here's another one that I think that many doctors even don't know, that estrogen hormone is an anti-inflammatory.
Oh, really?
Estrogen hormone is an anti-inflammatory. It's worth repeating it twice. Right, Liz? Estrogen is an anti-inflammatory. So what does that mean? When estrogen is zero in our bodies, so what does the immune system do? Inflammation, and it's a chronic inflammation. There's a difference between acute inflammation and chronic inflammation. Acute inflammation is when we break a bone, step on a toe, step on a nail, or something, injury happens that is an invader. So then all the fluid, all the blood rushes over to protect that area from the invader and be able to let it rest and let it heal. But chronic infection is something that is throughout the whole body, takes over all of our organ systems and chips away at it, eats it up. So that's why we have faster wear and tear in our bodies, from bones to tissues, everything from kidneys, liver, heart, you name it, and faster aging, right? So far, so good? Well, not so good, but I mean, you're with me? Okay. Well, at the time when we are supposed to be at the optimum level of our lives, that we have to live for the rest of our lives with all these symptoms, that is just not fair, because there are so many people that, career women, that they need to be able to make executive decisions, run businesses, take care of their families, but they can't focus. They have foggy brain, they have depression, they have anxiety, heart palpitation, okay, all these aches and pain and joint pain and muscle pain and muscle weakness. So they quit their jobs. You know how they actually affect our economy. I have women patients who come in and say, I see my mom, I see my aunt, they're disabled, and they're constantly complaining about all these symptoms of pain. And I see some of the women in their 50s, 60s, 70s, they're still climbing mountains. They're still having good sex. They're dancing. They're thriving. I want, just doctor, make sure that I'm not on my mom's path. Put me on their path, because that's what I want to do, right? We're here to educate all of you so that we can empower you. That way you can be inspired in order to help yourselves. And help is out there. Help is here. So let's see. Let's go through this slideshow. Now that we've talked about a little bit about how am I doing with time? I'm doing okay. So we talked about some of the basic anatomy and physiology, and we talked about some of the gazillion symptoms that women could have when they go through menopause. And now let's add a little humor to this, because stress reduction is one of methods to be able to help ourselves with all of these symptoms. Okay, so menopause is a new chapter of strength and vitality. It's embracing menopause with positivity and lightheartedness. That's the humor. Sounds good? It's not the end, it's just the beginning. Menopause is not a punishment. God is not mean. How come you're not laughing? I should put their laugh. Clap. God is not mean. And menopause is not a punishment. It's nature's way of giving women freedom to enjoy being grandmothers, to finally focus on their own self and connect with themselves in a whole new way. Finally, we don't need to worry about diapers, waking up in the middle of the night with the baby crying, taking them to school and back, right? Then we can sleep difficulties. Thank you. We're gonna see it again. But this is the time that we can get rid of okay, cover your ears, those that don't want to hear any swear word. Who gives a shit back there? Sorry. We need to focus on ourselves. Give me a clap. Yeah, I don't use swear words. This was special for today. We need to focus on ourselves. So, to embrace the joy of becoming a grandmother without worrying about diapers, we said that already. To shift focus towards ourselves and for decades of caring for others, now it's our time to reconnect deeply with themselves physically, mentally, and spiritually. and to finally have the freedom to live on their terms. Here's a grandma with their children. Here's another grandma just enjoying their children, right? Not have to worry about any responsibility. But this grandma does a little more. I bet you she changes the diapers too. But look at her. Look at that smile on her face.
Labor of love.
Labor of love. What is menopause? Okay, most of this we've already talked about it. I already talked about it. So natural stage of life. It is a natural stage of life, people, not a disease. Okay. And 12 months without period after age of 51. Okay. So perimenopause, it's like women playing musical chair. So hormones are crazy. All over the place, up and down, and we get all, emotional and irritable and sleep problems and wanting to rip off people's heads. So that's like playing musical chair. But if you look at it that way, in a fun way, okay, menopause is the final menstrual period, and postmenopause is the years after with the new health focus. But when we're at postmenopause, guess what? With that musical chair, playing musical chair, now we have our playlist. Now we can enjoy our music that we enjoy doing, right? So anyways, we touched about this. Estrogen goes down, progesterone goes down, testosterone goes down. It's a domino effect. That means it affects all your system organs, from the brain all the way down and everything in between, right? Who likes that? Flappy arms, muscle weakness. I don't enjoy it. But as we go through menopause and postmenopause, this is exactly what happens if we fill in the blank, if we don't do something about it. If you don't do something about it, if you don't take care of it, this is what's going to happen. Less muscle. And guess what? Many Western or conventional doctors don't know this. Many other doctors, even alternative doctors that I've talked to, they don't know this. That muscle tone, it helps to regulate our hormones, other hormones as well. We're talking about serotonin, norepinephrine, dopamine, and other hormones as well, right? Not just the sex hormones. Okay, let's go through this. Hot flashes, night sweats, brain fog, mood swings, sleep problems, Roya, vaginal dryness, weight gain, muscle and joint ache. Okay, 50 shades of brain fog. Who experiences that? Vasomotor symptoms, it's just a terminology for hot flashes. Okay, won't get into the the science part of it. I say words. This is when you want to rip off the person's head because you're so irritable. I say words, but I mean other words. You just have to, make your own translation. Miss Roya, what do you interpret this one as? What? Sleep disturbances. Yes, because of, everything that the mind is racing, heart palpitation, but also hot flashes again and the chills that come after it. Okay, weight gain, we don't like that, obviously. Hair loss, no. Wrinkles in the, everywhere, because we lose collagen again, right? So believe it or not, when we remedy to the best that we can all the hormones to bring it back, we can reverse a lot of these. Right, Liz?
Yep.
Okay. And then we've got bone loss, osteoporosis. We know about this. Who knows that the bones that we're born with, and as we age, we no longer have those bones, because those bones is like Pac-Man. They eat them up and they poop right after. So they make new bones. So these bones that we have now, we didn't have them when we were younger. However, when we age and the hormones go down, we have like a Pac-Man, eating up those bones, but they're not pooping as much. They're not building and remodeling the bones. So that's why bone brittle bones, osteoporosis happen. So what's wrong with osteoporosis? Weaker bones, more prone to chance of falling down and then breaking, and then at age of 60 or so, when you break your bones, then most people, they go through surgery. 29% at that age after surgery, even they die due to complications or whatnot, or just not being able to be active like before, and so on and so forth. Okay, that's something that we don't want to go through. Muscle pain, joint pain, we talked about that. Long term, okay, we talked about all of this. Holistic management of these symptoms. Lifestyle needs to be changed. Strength training and movement. More strength training. The more I read, the more I believe that we need to do resistance exercises, even using your own body weight, or strength training, as opposed to cardio. I'm not saying don't do cardio, but focus more on building muscle tone. Okay. I'll let Liz cover the supplements, sleep, Miss Roya, and stress management. Okay, we can stop the domino effect. Okay. HWC, we have invested so much here because of all these reasons. I've been reading about hormones, plus, my own neurological disorder, plus, many other reasons as to why we invested on all these amazing technologies, the best of the best in the industry, so that we would have the means to be able to reverse, or as much as your body allows it, and be able to take care of ourselves, so that for the next third or more, what's left of our lives, we can still be functioning, running business, taking care of families, taking care of the world, taking care of everyone and families. And, I see all these amazing, beautiful women, powerful women, that they do take care of the world. So that's what we want to do, right? So mild HBOT. At this point, I was going to ask questions, but I see that I'm seeing the sign for my time is almost up. So boost oxygen, and oxygen reduces inflammation. Remember how we talked about estrogen not being non-existent, so therefore estrogen being anti-inflammatory, so the body starts causing inflammation. Supports brain clarity and recovery. M-Sculpt Neo is for building muscle mass, burning fat, okay? Helps with the skeletal system, and also visceral fat. Visceral fat is the fat around the organs, which is causes all kinds of heart issues, total body health challenges. Mcella is for pelvic floor muscles, incontinence, sexual health, lubrication. It helps with, remember we talked about painful intercourse, painful sex, so it helps with that. Brain tap for stress reduction, for sleep. And I'm going to keep pointing at you every time it comes to sleep. Okay, so with shape scale, we can track our body composition, not just a regular scale. Chiropractic, it's making sure that your whole nervous system from brain all the way down is intact and not interrupted or irritated, and it functions at its optimum level. Okay, you tell me, menopause, is it end of vitality, true or false? False, for sure. Okay, HRT, do we know what HRT is? Hormone replacement therapy. Is it the only thing that works?
No.
False. That's not the only thing. All women suffer the same symptoms. False. I'm helping you with your sleep already. Okay, embracing the transition, a chance to focus on self-care, opportunity to build strength, time to reconnect with self and purpose. I love that. Menopause is a transition, not an ending. With knowledge and support, we can thrive. So Miss Liz is going to take over from here, and then hopefully, if Miss Michelle tells me that I have 2 minutes, I like to sit here and go over a few words of affirmation at the end. Liz first. Oh yeah, I'll sit down. Okay.
Okay. There we go. All right. I am pretty sure I've met almost everybody. Let me get this going. So thank you for joining us. And Dr. Naz was great and covered the hard part, which is getting through the science of what happens in our body. So I'm going to kind of summarize that a little bit and not go too deep, since she did a great job at that. I'm actually going to remove those.
Here, if you don't need the board.
No, but I'm going to remove these so that's not distracting. Okay, there we go. All right. So I think I've met everybody here, but I'm Liz. I am a medical nutrition consultant here in the Bay Area, and I work with Ortho Molecular, and we are the manufacturers for the past 35 years of professional medical grade supplements that you can only get through licensed physicians. So they're high quality, and our raw materials have USP certified, so they are the highest raw material that you can find. So that's just a little intro there. But I'm going to dive in because we talked about the symptoms, but actually 20% of women, if they're lucky, they actually have no symptoms. 60% have mild symptoms, and I would say probably I hear higher than 20% may have severe symptoms as well. But 4 years ago when I started looking into menopause and just what happens inside of our bodies, what I found so fascinating was that only women and whales, 4 different types of whales actually go through menopause. It's very rare in nature, and there's actually a spiritual meaning behind that, I believe. And so the orcas, pilot whales, belugas, and then narwhals go through menopause. And then it's a very unique part of life, and it's not a biological mistake like Dr. Naz said. And there's actually the grandmother hypothesis, which many scientists believe that we evolved this way because we're paramount to the survival of our species. And by living past our reproductive years, we're able to continue to pass on the knowledge and care to help nurture our community. So we're also pretty long living animals, so it's pretty cool that we're able to continue past those childbearing years compared to other animals in nature. And then she covered all this. We have normal cycles, and then the estrogen drops and stays low. And then if you're interested to see where you may be on the scale, there is a standard menopause rating scale, and you can break it down into a few different categories here. So there's going to be physical, psychological, and then urogenital challenges. So I can email you this, Dr. Naz, if you want to, if anybody wants to go over that.
That'd be great.
You can kind of see which category you may need more support in. It's just an easy way to pinpoint that. And then I will skip this since we already covered this. Okay, now into the natural approaches, which I'm not a physician, but I am an expert in the raw materials used to support these types of transitions. So we're going to talk a little bit about phytoestrogens. And the first product, if there's anything that you want to help do a daily signal to help mimic estrogen in your body through a phytoestrogen, it's going to be the Ultra Meno Harmony. And I'll break this down here for you guys in a second, but it's designed to be used during perimenopause. And then you can continue to take it forever if you would like. Just like HRT, you continue to take the hormones so you get those signals in your body. Same for this, you can just take, it's a small capsule, just take it every day to signal the estrogen that you've lost over time. Okay, and the other things, the hormone balance, inflammatory balance, like Dr. Naz said, because even though it's not what we produce for estrogen, it has the same structure, so it does mimic the role in positive mood. And I don't know if you guys love to eat rhubarb. Some people do. I do. I used to eat it out of my garden as a kid, but Chinese and Indian rhubarbs are known to have more of a laxative effect. This is a specific raw material coming from Siberian rhubarb. So it doesn't have any laxative effect, but this specific, the one on the left is what we're using, the Rampontic rhubarb, Siberian. This has a very selective binding capability because if people have a history of like breast cancer or hormonal related cancers, what we find is you want to be careful with hormone therapies and things like that. So the cool thing about this is it's very well studied for decades and it's very safe to take long term. And so this is a nice little example of how similar they are. So you can see you're getting most of the receptors parts binding besides this aspect right here. Just a little bit of a different chemical structure, but mimics the activity. Okay. Now, what I was mentioning about the history of breast cancer, if anyone's concerned about that, there's two main types of estrogen receptors that we have. We have estrogen receptor A, which is alpha. That's found on the breast, ovaries, liver, and bones. That is more associated with proliferation, so cells multiplying if they're overstimulated. And then we have estrogen receptor beta, B, which is found ovaries, prostate, lungs, GI, and then your central nervous system. That's associated with anti-cancer and supporting that, so anti-proliferation effects. And what the Siberian rhubarb only combined to is the beta, so the good receptors. So just want to point that out, as you can see here. All right, and then going through some of the studies regarding this exact raw material, like I said, it's really well studied, but the actual raw material you'll see is the ERR731. It was founded in Germany decades ago, and that's just the area code. I was wondering why it's called that. But what they found was that it's selective to the estrogen receptor beta right there. And then going into how it actually supports your hormone levels here. Just some interesting things here. But the first one mimics the estrogen activity, and it can have pro-estrogenic effects. So where estrogen is low, it can help go to those receptor sites and fuel them. And then it also has anti-estrogenic effects. So if somebody has high estrogen levels, it can help balance that. So it's a modulator in your body, which is pretty interesting. And then the modulating aspect is what I just said. And then it also has antioxidant properties, probably not as potent as the HBOT does, because that's a hefty antioxidant product. It really does the job there. Okay, now going over some more research just to show you guys the results that you would see if you are interested in taking this now or in the future. So this is 110 women, 12 weeks versus placebo, and the ERR raw material, which is that Siberian rhubarb. And what they found was looking at menopause rating scale. So that first scale that I showed you showing the scales that you can, or the check mark to see what your level would be. What they found was that after 4 weeks, it went down. The blue's placebo and the pink is the symptoms. So they start going down, and then this is up to 108 weeks. They studied it. It stayed low. Now, what are those symptoms that they were looking at? They were looking at hot flashes. So the first line is the first 12 weeks of taking this raw material. And again, I'll do a little, before I jump into this, I sometimes get questions about, okay, if this is rhubarb in a capsule, why can't I just eat rhubarb? And this Siberian rhubarb is packed with water, so it has to be standardized, broken down, and purified. And then you want 4 milligrams. You don't want fluctuating doses because you're going to get a different effect every day. So that's just, you would have to eat like 6 dry spoonfuls of the rhubarb to get the same amount of the phytonutrients that is in 1 capsule. So that's just a little bit of analogy to think about. But the first 12 weeks, hot flashes decreased 66%, and this is 110 women. And then irritability went down 79%, negative mood went down 76%. Rip the head off, I heard that. Irritability too, right? And then vaginal dryness, 45% decrease. And then the sleep disturbances, 69% decrease. And they stopped the placebo group because they're not going to make women take a fake capsule for another 2 years. But they continued with the group taking the rhubarb. And what they found was after 108 weeks, which is about over 2 years, they found 86% decrease in hot flash. Irritability went down 97%, negative mood 99%. It could have been a good day when they were filling out that chart. But vaginal dryness went down 68%, and then sleep disturbances went down 91%. So, yeah.
When a woman is in postmenopausal for several years, would they still benefit from taking this?
100%. Yeah,
Thank
you would get those signals coming back in, because you were mentioning earlier about how prevalent the psychological stress is in our society. And there's a recent study that just came out of the UK looking at women who are in that menopause stage. 1 in 5 women actually quit their job during this transition because we don't have the psychological support that we need. Like, the science needs to evolve, and unfortunately, maybe we just got to do it. We got to do our own studies. But yeah, so these are pretty staggering numbers, and this raw material is pretty popular in medicine because it does do such a good job at just the gentle signals of that estrogen mimicking. And I do get questions if someone is on HRT. You could take this, but the HRT would be doing the job. This is really for people who want a natural option that's easy and affordable.
Nice.
Okay. And then also, this is 109 women looking at the anxiety scale. So they took a quiz or they took an examination looking at what their anxiety scores are, and they found significant decrease in those 12 weeks again. So this is a very simple raw material. We have phytoestrogens that are extracted at 4 milligrams, and the capsule's small as well, but you can take it in the morning or night. My mom just keeps it by her bedstand, and she'll just take it in the morning when she wakes up, and then just easy way to remember. But do you guys have any questions on this one before I go into
One every morning?
One every morning.
Easy.
I do have a question.
Yeah.
What's the difference between that and the drops?
Yep. So that is going to be more for immediate stress. That's GABA and L-theanine and something called huperzine A.
Neuropeace.
Yeah, so if you put those droppers under your tongue, I keep one in my car in case I get into traffic. Or I took one before I came here too, because I feel like it helps scattered thoughts.
Calms you
just
down.
helps you keep calm.
Yeah.
But yeah, so this is for more transitioning through menopause and after, and then that's for anybody who's just looking for immediate like calmness in 30 seconds. So, all right, yeah. All right, now we're going to talk about a bit about we're going to talk about UTIs real quick, because that is very tied into the transition through menopause as well. 50 to 60% of women have at least one in their lifetime, but it really spikes after menopause, and they are not fun. I'm sure most of us have had one here, and you usually have to go on an antibiotic, and it throws your gut off for a while. And then after menopause, up to 1 in 3 women experience them being reoccurring. And then estrogen levels are lower, so your lining of your bladder and your vaginal lining start to decrease a little bit. And this allows for more E. coli to be present. And as we know, UTIs really impact our sleep, work, intimacy, everything, our whole life. So this is Ultra UT Protect. As you can see, you're probably familiar with the raw materials. We have dandyleaf extract, hibiscus, and the ellie rose, and then we have cranberry fruit, not cranberry juice. I see a lot of people online, they'll drink like a huge thing of cranberry juice every night, and I'm just like, oh, that makes my stomach hurt. But this is going to be an easy thing to take if you do have reoccurring UTIs, or you want to be preventing, or do you just want a healthy urinary tract in general. So the first ingredient I'm going to go over, we have 120 milligrams of the athrocran. Now this is, it's a cool raw material because they extract you need 34 pounds of cranberries to get 1 pound of this extraction. And then there's the pure fruit, it's no sugar additives. And then you get 25 more fiber, and then 3% more antioxidants than regular cranberries because of where they are sourcing them from. And then this is also delivered in a delay release capsule. This is very important with some supplements, because if you're taking it and it's just going to dissolve in your stomach acid, it's not going to make it to the lower tract at all. So that's important with probiotics and things for the urinary tract too. Okay, looking at some fun studies. This is one looking at, can concentrated cranberry extract prevent recurrent UTIs? And this was 12 women. They were 25 to 70, but they had 6+ UTIs a year, which is very, very debilitating. And they took 200 milligrams of the cranberry extract, and they did it 1 capsule for 12 weeks. And they did a 2-year follow-up, and they had no UTIs reoccur. So, and then
Very nice.
at year 2, 8 women were still UTI free. No UTIs after the side effects after the 12 weeks, but then after 2 years, they re-followed up, and 8 women were still UTI free. That's what it is. Okay, and then for dandelion leaf, this actually increases your ability to urinate. So it's very commonly used in Germany. They recommend it for people if they have some type of bacteria buildup. This helps flush it out. And then the hibiscus leaf, I love keeping hibiscus tea in my cabinet too. It's a very feminine flower. I love it. But what it's very potent, I would say it's one of the most important ingredients in this formula, because it actually prevents the bacteria from sticking to the uterine lining, urethra. And then let's see if there's any other important things. Oh yeah, and hibiscus has been studied to have similar effects to antibiotics, specifically for gram-negative bacteria. So it's not going to kill your happy bacteria, just gets those E. coli and salmonella and things like that. And then for a study, this is 61 women who had reoccurring UTIs, 4 more per year. And then the study was done for 6 months, and they were either taking 200 milligrams or that was 90% polyphenols, or 200 milligrams that were 60% polyphenols versus placebo. And they found a 77% reduction in both hibiscus uses or groups for that urinary tract. All right. So this one is a product, if you do have reoccurring UTIs, you can definitely take it. I have had maybe like a couple in my lifetime, but it's something that I keep on my shelf, because when I do have some type of symptom maybe come up, I'll just start taking it right away and it will subside. There is one more product if somebody does have an active UTI. This is Protect, so it's more of a defense. This product is more for when there's an active UTI. It acts as a antibiotic from the waist down. And this is going to be uva seed. These are all natural ingredients. Marshmallow root, bladderwrack, celery seed, and berberine, which are all help with clearing out bacterial infections in the urinary tract.
So you would take that instead of an antibiotic?
If somebody would prefer that, yes, you can take this one instead of the antibiotic.
And how fast would it start working?
So like an antibiotic, you usually do 7 days of the full round, but usually symptoms start to subside around like 3 days, I would say 2 to 3 days. But you take this product, there's a specific dosing for depending on what you need. So I have that for
We
Dr.
have the
Nas.
protocol.
But usually like 3 to 4 days, symptoms start going away as well. But
With no side effects.
No side effects.
Such as the antibiotics. The side effects of the antibiotics killing pretty much your microbiome.
Right.
Yeah.
Affecting your gut health.
Yep. So that's for an active UTI, but that's why I love this one, because we can, if you feel something may be happening, you can do this one and kind of prevent having to go down the antibiotic or, going in for rescue. But any questions for this one? It's just one capsule. Doesn't matter if it's with food or not. So it's totally just safe to take every day because it's just cranberry, hibiscus, and dandelion. But if somebody doesn't have UTIs, if you're fine, you don't need it. But if somebody has had UTIs kind of frequently, or maybe one a year, this is really good to prevent that from happening again.
And then, let's say if you take this one, if you have frequent UTI, so how is it something you take every day? You stop?
Well, I sometimes I forget to take a supplement here and there. So it's up to you. If you want to take it every day, that's going to help with urinary tract and, help with the inflammation, help with keeping it clean from bacteria. Totally safe to take every day. But I like to rotate my supplements because I take so many. So, I'll take my vitamin D every day, but I'll rotate sometimes my L-theanine, or I'll rotate some stuff. So if you want, you could rotate this, but it's just nice to give these type of standardized raw materials to signal clearance in our urinary tract. But yeah, okay. And then to wrap up, I think most of you guys were here for my vitamin vitality, but vitamin D3K2 is so important for women, especially our whole lives, but once we get into the menopause stage. And so I'm going to jump into this real quick. So osteoporosis, 1 in 2 women over 50 will suffer with some type of osteoporosis related fracture. Deficiency for vitamin D is up to 70% in postmenopausal women, and the heart health impact goes up 30% higher, and then fall risk go up by 20%. And I'm going to jump into why K2 is important. And I probably went over this last time, but as a reminder, our vitamin D levels are so important. And if you guys don't know yours, I would recommend go checking it out. I'm pretty sure most insurance cover the vitamin D testing too. But this is a meta-analysis looking at hundreds of different studies over the decades. And what they were looking at was people's disease incident and how they could prevent it by their vitamin D level in their blood. And so they were looking at, I know it's a little small, but all cancers combined. The pink one right here, the breast cancer, is my favorite one to look at because it can show you if you get your blood results back and you're around a 31 nanograms per deciliter for your vitamin D level, it decreases your chance of acquiring breast cancer by 30%. But if we move the vitamin D level up to about 51, it goes down further by 83%. So there's so many different things here for falls for women. But I like to point that out because I think it helps with compliance and helps you put a picture, why do I want to take this? Okay, and as far as probably the most important thing about vitamin D is the kind you're taking, because most of the stuff on the market is oxidized. Mm-hmm. And that's because you need a pretty expensive encapsulation process for it to actually be able to be used in your body. And so for instance, I'm just going to pretend I'm working in the manufacturing facility, but if I'm just putting a bunch of vitamin D in a capsule all together and it's touching each other, the whole capsule could go rancid, because if one vitamin D molecule goes bad from oxygen, the whole capsule will spread to that, and it could do more harm. It could do more harm than good. And then we do a patented process with a company called Lycored, and so each capsule has 100,000 tiny little micro and encapsulated beadlets that protect these different molecules. So if one goes bad, the whole capsule is still okay. So I like to point that out. And then we also don't use soybean oil like most companies. You'll see that at Costco when you look at the back of the bottle there. And then ours is dairy and soy free. Okay. Now the fun part, or why should you take vitamin D3 with K2? So most of us, we get calcium in our diet, and then we can supplement with D3, or if we spend a nice while out in the sun every single day, we can get some vitamin D converted. But with vitamin D, we have something called inactive osteocalcin. Picture that as your little shuttle that takes calcium and drives it into your bone. But there's no gasoline without vitamin K2. So that's the gasoline. That's why a lot of people pair them together. And when you add the K2, you can actually, this is why it's very popular for men's health as well, because they tend to have a little bit more arterial calcification. And they actually can cleave off this calcium buildup on the arteries and shuttle it back into the bone. So you get clean arteries and strong bone.
Sweet.
And then this is probably...
That's the K2 part?
Yes. Mm-hmm. Yep, okay. The K2 part does that. So that's the gasoline that activates that osteocalcin.
Now, it's hard to find vitamin D3 with K2, like over the counter, correct?
That's why
you wouldn't want to buy it from over the counter.
I'm
Take it away, Liz.
I'm just saying in general.
Yeah.
I haven't seen that.
Yeah, there's it's the thing I see a lot is it's soybean oil based, which is unfortunate because I don't think soy is bad, but soybean oil, I don't really like to be taking it with my vitamins. But we use MK7, which is kind of getting into the weeds with it, but the MK7 has the best half-life in your body. So that's why we use that type of K2, but there's some not great formulas on the market for sure too. You'll find that.
But also, Roya, these products are clinical grade.
Yeah. Mm-hmm.
I'm sure Liz can explain it better as to the ingredients, where they're farmed or harvested and eventually got here.
By the company that you work for, but then you guys put your labels on it? Is that how it works?
Yes.
Mm-hmm. And so this is probably the most popular study that you'll come across for the K2, but this is 4,800 people, all 55 years and older. They had them supplement with 180 micrograms, which is what's in the K2 Synergy. And they did a 10-year follow-up for these patients. For the people that took the K2, 50% reduction in that arterial calcification, and then they also had a 50% reduction in cardiovascular death. And a lot of that has to do with because our blood is flowing. So K2 is awesome for our bone health. Any questions on that one?
Yes.
Yes.
Sorry.
Go for it.
Question. So in general, how much vitamin D3 are you supposed to take per week?
Great question. There's a couple ways you can go around it. And it depends on your serum level, but most people recommend 5,000 a day. And you'll just use that throughout the day. You'll take more. If somebody has a low serum level and they need to get it up, you can take 50,000 once a week. So I'll do that. I'll do that usually just because my serum level needs to get up right now a little bit more. And so on Tuesday, I'll just take it. And then that's my 50,000. And then after I do like 15 weeks of that, which they have a 15 count bottle for that, then you go to the vitamin D3 K2 because we want to raise the serum level up. So 15 weeks of the 50,000 IU, and then after those, once a week, after those 15 weeks, you do the daily.
For example, if I take this, obviously one capsule a day, correct? But if I've heard, I mean, because it's a fat soluble vitamin, right? Vitamin D. So can you take like 5 capsules on a Monday to like cover you for the week, for example?
So with the vitamin D3 K2, the K2 I wouldn't recommend because this is like a specific dose for K2, but you can go higher with the 50,000.
And that's just vitamin D, 50,000 IU.
Yeah. So if you wanted to like take a bunch in a day to cover you for the week, you would do this.
Just do one of these.
But then this one is one a day.
Correct.
But
once
I'm not saying
a week.
To do that, but I'm just saying.
Right. That's a good question. That's once a week.
Once a week. It's fat
So
soluble,
when you
like
take that once a week, you do not take that other one with K2.
Yeah, you don't.
You do not.
No, but then you're missing the K2.
So that's why I recommend if you don't know your D levels, go check it out. But I like to typically most practitioners I work with will recommend 15 weeks on this, and then after you can switch to daily, which is has the K2 in there. But like you said, it's fat soluble. So when you take the 50,000, it goes to different areas of our body, and then we pull from it throughout the week until we need more. But you lose 46,000 or 4,600 IUs a day in your body. So that's why 5,000 is good to replete.
Good question, Raya.
Very good question.
Is that the last supplement that we
yes. Yeah, I could. There. And then this is also important. There's a lot of K2s out there. This is the most studied and best MeniQ7 Pro. It's called. It's a type of K2 you want to take. And I realize I don't have a maca slide in here, so I don't know if you want to say anything.
That's okay. Was that your last one?
It just had some journaling in there, but yeah.
Really appreciate it. Great job as always. So among the other supplements, thank you, Liz.
Time.
Among other supplements that menopausal ladies should take is magnesium, which is for muscle recovery, for sleep, for a great bowel movement the next day, sleep. And just for fun. I told you we need to add a little humor here. So golden calm for anti-inflammatory, and then very important fatty 15, which is omega-3. So that's very important for the cardiovascular health, because when menopausal women go to their doctors, OBGYN, and if it's a conventional doctor, they don't know how to treat it, they don't know what to do with it. They say, they check the blood and they say, well, your cholesterol has gone up. What do we do? Put them on statin, right? But it's not the cholesterol that they should be worried about the heart problem. It's the low estrogen that they should be worried about, right? So omega-3 for heart health, that's an important one. And I'm sure probiotics because again, zero estrogen means affecting gut health. So we need to help the gut health microbiomes. Mighty Maca we have a lot of, I mean, there's just so much to talk about Mighty Maca that would help with the, all the, bioidentical hormones that we need in our bodies. Plus it's got, protein and collagen and so on and so forth. This little thing, who's used it besides me? Yay! Yes. So, but continuously, not just one time and see results. Julva, you put pea size from this on your clitoris, and then you go all not inside, outside.
I wasn't expecting that.
You weren't expecting to hear that from me, Roya. I'm a medical doctor. There's no other medical terminology for it, just accept that. And then down by the labiums and all the way, just on the outside. And it helps with lubrication. It helps with your libido. And also it helps with, easier intercourse, less pain because of more lubrication.
But it's not a lubricant. So
it is not inside. It does not go inside.
It's a treatment that you'll do. Yeah, and I think it says on there you do it so many days on, if I'm not mistaken, on the cream.
Right.
You do that, so it's not used as an aid to your sexual wellness, but as your personal wellness. It's to help keep you comfortable.
So, ladies, okay, so if I may, just take a couple of minutes and say a few affirmation words. Is that a right time?
Yes, please.
And then after that, we can quiz them and give them some goodies. Okay, so words of affirmation. If you want to say them with me, if you want to whisper them in your head, you're welcome to do what's comfortable for you. So please join me in a few words of affirmation. I am not my past.
I am not my past.
I am not my pain.
I am not my pain.
I am not my diagnosis.
I am not my diagnosis.
Here's a special one for today. I am not my menopause.
I am not my menopause.
I am conscious.
I am conscious.
I am intelligence.
I am intelligent.
I am energy.
I am energy.
Energy that is the greatest healer in the universe.
Energy that is the greatest healer in the universe.
And in that energy field, there are infinite possibilities of miracles.
In that energy field, there are infinite possibilities of miracles.
Miracles that are not only possible, but they're inevitable.
Miracles that are not only possible, but they are inevitable.
We're not here just to survive.
We're not here just to survive.
We're here to awaken and thrive.
We're here to awaken and thrive.
We are divine intelligence.
We are divine intelligence.
We are connected to infinite intelligence.
We are connected to infinite intelligence
that repairs,
rejuvenates,
regenerates, and I am grateful for the divine intelligence in me that heals my body.
And I am grateful for the divine intelligence in me that heals my body.
And I am certainly grateful for all of you, and including our one man here.
I feel like we should go sit around the fire after that together and have like some stupid chat.